Dave had done everything right. He saved for 30 years, maxed out his 401k, paid off his house. At 61 years old, he was ready to retire. But then his financial advisor said 4 words that stopped him cold. What about health insurance? Dave went quiet, because Medicare doesn't kick in until 65, and he was staring down 4 years, with no employer coverage, no plan, and a body that wasn't getting any younger. He almost went back to work. Almost. But instead, he found something most people never bother to look for. And today, I'm going to show you exactly what Dave found, because chances are, you're in the exact same position he was. Let me be real with you for a second. This is the part nobody talks about in retirement planning videos. Everyone's obsessed with. Do you have enough saved? Is your 401k big enough? But here's the thing nobody warns you about. Healthcare is the #1 reason people delay retirement in America. Not savings, not investments. Healthcare. A single hospital visit in this country can cost you $20,000, $30,000, sometimes more. And if you retire at 62, you've got 3 years with no employer plan, no Medicare, nothing, unless you figure it out. I've talked to so many people in their late 50s who are financially ready to retire, but they're trapped in a job they hate, just for the benefits. Does that sound familiar? If it does, keep watching, because this video is specifically for you. Now, before we get into the actual options, I want you to understand something important. There is no one-size-fits-all answer here. What works for your neighbor might not work for you. What worked in 2018 definitely doesn't work the same way in 2025. So what I'm going to do today is walk you through the 5 real options that smart early retirees are actually using right now. What each one costs, who it's best for, and the mistakes people make with each one. No fluff. No selling you anything. Just the real breakdown. Sound good? Let's get into it. Option number 1, and honestly, this is where most early retirees should start, is the ACA marketplace, also known as Obamacare. Now I know what some of you are thinking. That's for people who can't afford real insurance. Stop right there, because that thinking has cost people thousands of dollars. Here's what most people don't know. If you retire early and your income drops, you may qualify for massive subsidies. We're talking people paying $0 to $150 a month for solid coverage. Here's how it works. The government looks at your income, not your savings, not your 401k balance, your income. So if you're strategic about how you pull money in retirement, you can keep your income low enough to qualify for serious help. For example, a 62-year-old couple with $60,000 in reported income could qualify for subsidies that bring their premium down to under $200 a month together. Now, the catch? You have to be careful about what counts as income. Roth withdrawals generally don't count. 401k withdrawals? They do count. Social Security? Partially counts. This is where a little planning goes a long way. And this is exactly why I always say, retire with a plan, not just a number. Option 2 is COBRA. Now, COBRA gets a bad reputation, and honestly, sometimes it deserves it. COBRA lets you keep your employer's health plan after you leave your job. The problem? You pay the full cost. Your share and your employer's share. That can be $700, $800, even $1,200 a month for a family. So why am I even mentioning it? Because for some people, in very specific situations, it actually makes sense. If you have a major surgery coming up, or you're mid-treatment for something serious, switching plans can be risky. Your doctors might not be in network. Your medications might not be covered. In that case, paying a little extra for COBRA, just for 6 to 12 months, might actually save you money and stress. But I want to be clear, for most healthy early retirees, COBRA is a bridge, not a destination. Use it short-term if needed, then move to something more affordable. Option 3 is one people overlook all the time. If your spouse is still working, even part-time, check if their employer offers coverage that includes you. This is honestly one of the cleanest solutions out there. You retire, they work a few more years, or even just part-time, and you ride their health insurance until Medicare kicks in at 65. Now I know some of you are thinking, my spouse wants to retire too. Fair enough. But consider this. If your spouse works even just 2 more years, maybe part-time, maybe at a job they actually enjoy, and that job comes with family health coverage. You could save anywhere from $15,000 to $30,000 in healthcare costs over those 2 years. That's not nothing. That's a trip to Europe. That's a new car. That's money staying in your pocket. Option 4 is one that a lot of people have never heard of, and it's also the one that gets the most mixed reactions: health sharing ministries. These are not insurance companies. They're communities, usually faith-based, where members pool money together and share each other's medical costs. Monthly costs can be significantly lower than traditional insurance, sometimes $200 to $400 a month for an individual. So why isn't everyone doing this? Because there are real limitations you need to understand. Pre-existing conditions may not be covered. Will be paid. It's a community agreement, not a legal contract. And not every doctor or hospital accepts them. So who is this good for? Honestly, someone who is generally healthy, has low medical needs right now, and is just looking to cover themselves against a catastrophic event. If that's you, it might be worth looking into. If you have ongoing health issues, I'd be careful here. Option 5, and I saved this one for last because it surprises people the most. Part-time work, specifically, for the benefits. Now hear me out before you roll your eyes. I'm not saying go back to the grind. I'm saying there are companies out there that offer health benefits to part-time employees. Starbucks, Costco, Trader Joe's, UPS, REI. Some of these places offer health coverage if you work just 20 hours a week. And here's the thing. Some early retirees actually like this option. You stay active. You have some social interaction. You have a little extra income coming in. And most importantly, you have health coverage without draining your savings. It's not for everyone. But for someone who retired and is finding the days a little too quiet, it might be the perfect bridge. Okay, so now you've got the 5 options. But here's what I really want you to take away from this video. The smartest early retirees don't just pick one option and stick with it forever. They layer these strategies based on their age and situation. Let me give you a real example. Meet Sandra. She's 62, retired last year. Husband is 64. Here's what she did. Year 1 and 2, she used her husband's employer plan. He worked part-time at Costco. Year 3, husband retired. They both switched to ACA Marketplace, kept their income low using Roth withdrawals, and paid under $180 a month combined. Year 4, husband turned 65. He went on Medicare. Sandra stayed on ACA for 1 more year. Year 5, Sandra turned 65. Medicare for both. Total healthcare costs for 4 years of early retirement? Under $12,000. Combined. That's it. Because she had a plan. Not luck. A plan. Remember Dave from the beginning of this video? He ended up using the ACA Marketplace. Kept his income low in those first 2 years using his Roth IRA. Paid $112 a month for coverage. He told me. And I'll never forget this. I spent 30 years working for a company. And I almost stayed 4 more years just because I was scared of a health insurance bill I never actually looked into. Don't be Dave from the beginning of the story. Be Dave at the end, sitting on that porch, knowing you figured it out. Because you can figure this out. The information is out there. The options are real. You just needed someone to lay it out plainly. And that's what we do here. If this video helped you, do me one favor. Share it with someone who's thinking about retiring early. Because I promise you, there is someone in your life right now who is staying at a job they hate just because they're scared of this exact question. Send them this video. And if you want to go deeper, I've got a full video on how to use the ACA strategically to pay almost nothing in premiums. Link is right up here. Also, drop a comment below and tell me, how old are you? And what's your biggest fear about retiring before 65? I read every single comment.